Rahim. A 4-year-old boy is brought to the emergency department with vague chest discomfort. 2 months ago, the patient was involved in a high-speed motor vehicle collision but sustained only minor injuries. He was absorbed in the emergency department overnight and discharged home. Medical history is otherwise unremarkable. Vital signs are normal. Auscultation of the lungs show decreased air entry into the left lower base. An X-ray of the chest is shown below. Which of the following is the best next step in management of this patient? So this patient is a 4-year-old boy. He is brought to the emergency department with vague chest discomfort. 2 months ago, he was involved in a high-speed motor vehicle collision but sustained only minor injury. After that, he was observed in the emergency department overnight and discharged home. Auscultation of the lungs showed decreased air entry into the left lower base. So based on this is the X-ray of this patient. This is the X-ray of this patient. So based on this hint and the X-ray of this patient, diagnosis of this question is diaphragmatic rupture. I will show the finding in these X-ray that why the diagnosis of this question is diaphragmatic hernia. So come to the X-ray. So here as we can see here that this is the as I highlighted here, the blue one is a NG tube with a nasogastric tube, and here the red marker is the fundus of the stomach. The bilateral green, the tube that is green in color, this is the chest tube, and the red one is a greater curvature of the stomach. So based on these hints, the diagnosis of this question is diaphragmatic rupture, and diaphragmatic rupture should be suspected in a patient with prior blunt thoraco-abdominal trauma and abnormal chest X-ray finding, for example, bowel loops in the thorax, mediastinal shift. Delayed presentation can occur after progressive expansion of the diaphragmatic defect and abdominal organ herniation. So for the CT scan of the chest and abdomen can confirm the diagnosis. So here the correct option is choice B, CT scan of the chest and abdomen. Come to the incorrect one, choice A, chest tube placement. So chest tube placement is for the patient having pneumothorax or pneumothorax. Choice C, flexible bronchoscopy. So this patient has no respiratory distress or associated X-ray finding, for example, pneumomediastinum, pneumothorax, subcutaneous emphysema. So flexible bronchoscopy does not need for this patient. Choice D, intravenous antibiotic. So pneumonia is unlikely in the absence of fever and with a chest X-ray showing no infiltrate, therefore intravenous antibiotic are not required. Choice E. So delayed diagnosis can increase the risk of hernia formation and valve strangulation, which can be fatal. Thank you.